What are your thoughts on infusions versus nasal spray? Are there differences in efficacy? And I know there's multiple options for getting ketamine treatment.
Yeah, so the main deal with this has to do with bioavailability, which is how much. Well, there's a couple of parameters about this. One is bioavailability, which is how much of the medicine is getting into your body. So 100%, 80%. With an IV infusion, it's 100%. There's different modalities to get ketamine. IV infusion is 100%. If I give an injection, I can get about 93 to 96%. If I do it intranasally, it's 50%, roughly 40 to 50%. If I do the lozenge, it's around 30%. So different delivery methods, kind of you get a different percentage of the medication, and it's a little less precise. You know, there is, for a long time, ketamine was totally off label in the psychiatric world. It was pretty common for people to use it, but it was off label for the treatment of depression. And I think it was 2019 or 2018 or the end of 2018 or 19 where there was a medication called Spravato, which is the intranasal version of ketamine. That got FDA approved, and I'm grateful to them that they got FDA approval, because now I don't have to explain to everybody, well, it's off label, but it's still used in, you know, all these places and it's safe and all this. I can just say, you know, it is FDA approved for depression. But what Spravato did is they basically, a lot of molecules, there's a part of it, they're called chiral molecules, where part will rotate left and part will rotate right. And they took basically half the molecule and patented it. And so, you know, the great thing again about that is that they did the research. The negative stuff about that is now we can't do additional research without using their product on that part of the molecule. It ends up that the generic works just as well. And, you know, I think people have been using the generic for a long time. And so the pharmaceutical companies have been trying to figure out a way to kind of get in the market. And that's what Spravato is. But I don't know that it works as well as the intramuscular or IV delivery. I think to get somebody out of a funk, the IV or IM is the best way to go. If you're maintaining somebody out of a funk, you know, maybe there is a place for Spravato. There's certainly a place for Spravato if somebody's insurance will cover it. And people get better on it, like they get better on ketamine. It just takes a little bit more time.
Thanks, Dr. B. Are there sometimes, Linda, I think it's Linda, you know, asked also, are there sometimes negative reactions to the treatment, from the treatment?
And by negative reaction, well, I can't talk to her, but are there negative reactions?
You can ask clarifying questions if she's still on, for sure. And I don't know if she is, but I'm assuming, I'll just ask my question. Do people in treatment sometimes have a negative reaction to the ketamine?
Yeah, so look, a lot of stuff comes up during the dissociative or psychedelic experience, and not all of it is positive. And so I always say there's no such thing as a bad trip. There are challenging trips. But if you think about anything good that you've had in life, you probably got it by getting through something difficult. I mean, you think about school or, you know, marriage, you know, like there's
Sure.
most of the things that we have in life, we have to work for. And so I do think that there can be some challenging experiences during the ketamine infusion, but that's why we're here, to offer support through that.
Yeah, back to that model of some can do to the treatments, but having it in a therapeutic model.
I think what can sometimes happen after ketamine treatment is people have experienced something for so long, like a certain, like, I think depression can be kind of numbing at times. And people have experienced that numbness, and that numbness goes across all emotions. It goes across joy, but it also goes across anxiety. It goes across sadness. I mean, everybody's feelings are just kind of more muted. And when people have a real robust response to ketamine, it's kind of like bringing your emotions closer to you. You know, it's turning up the emotion kind of knob. And as a result, sometimes people will come in and say something along the lines of like, yeah, I don't feel as depressed, but I'm anxious like nobody else. And what that usually is a result of is just having access to these emotions that they have not experienced in a while. They don't remember anxiety. And so, you sometimes are discovering other issues that arise, and you have to deal with those over time as the process is going on. But it's not necessary. I wouldn't call that a bad reaction. I would just call that like a normal part of the process towards feeling better.
Gotcha. So somebody asked, it's anonymous, but excuse me. Can it help, in your experience, does it help someone retrieve a memory that maybe has previously been lost?
Yeah. I am, that's a hard question because
Yeah.
a lot of the stuff that can happen in a psychedelic experience, you're kind of questioning what's real and what's not real. I think what I would do with somebody that retrieved a memory is I would think less about the memory they retrieved and kind of more of what is the meaning of this. Like we didn't have time, but I had this magic trick set up that I was going to do, like, over the video and stuff. And it was going to be like, okay, some people might have known the trick, some people might not have, but like, what's your experience of this? Because we've just introduced like a little bit of magic into this. It was like a card trick. I have them all right here. And some people would be kind of turned off by it. Some people would like it, but it's this event that everybody has an experience of. And so if somebody retrieves a memory that they had not had before, I would try to work towards the meaning of it, as opposed to like, is this real or not real? To me, that's less important than what does this mean to the person. I think the person asking is probably wondering, like, would somebody recover like a traumatic memory of sexual abuse or something like that? And I've been doing this for 5.5 years. I haven't had that happen yet. But I would never say never.
Gotcha. Yep. Hey, Dr. Barton, we've gone over 20 minutes past our scheduled time, and you've done a lot of prep for this, so I sure appreciate you.
Yeah. And again, I'm happy to, I'm sure you have a busy schedule too. I'm happy to answer other questions, but I don't have anything after this. So that's
okay. Okay. So, let's see. Eric asked, and I don't know what this means, so I'm just asking it. Do you give sublingual root? And do you see any hallucinations or rebound anxiety during treatment? I don't even know what.
Yeah, so sublingual root is basically that's the oral root. So like that's kind of the same thing as a lozenge. So there are like sublingual, like usually that word is used with like Suboxone because you have to put that under the tongue. Sublingual means like kind of under tongue.
Okay.
But we do use lozenges. Lozenges really are more like when you're doing kind of the official ketamine assisted psychedelic psychotherapy, like you might start with a lozenge because they tend to be a little bit less intense, and they tend to kind of, the onset is more gradual, and the end is a little bit more gradual as well, but they linger a little bit. We will sometimes give lozenges, although this is not my preference, but sometimes for patients that are really having a difficult time, I might give them lozenges to take at home under like proper guidance in between, almost like a booster. And this is happening with COVID right now, is not everybody can get in, or not everybody feels safe getting in. So sometimes we've used lozenges to like extend the effects between the IM or IV boosters to help people out.
Tori asked,
I'm sorry, in regards to the hallucinations, yeah. So usually what we do, and we're kind of a more traditional, the psychedelic approach, which is what they do in the MAP studies, which is for the MDMA, which is we'll put on an eye mask and play some kind of emotionally evocative music during the experience. And so even though that you have an eye mask on, your eyes are closed, you see lots of patterns, or sometimes things become much more, it's not just patterns, it can be a hill or a person or whatever. and or it could be space. It just depends on the person, and that is also kind of dosage dependent as well.
Tori asked, she came in a little bit late, but
Hello, Tori.
what's the, yeah, what was the best protocol you've experienced with a patient coming in for major depression? And is it good support initially for a young person in their 20s that has been diagnosed with bipolar diagnosis? And again, I want to give the disclaimer that you're not, giving specific advice for specific people. You're only talking about your experiences in treatment related. But so.
I would say again, the cool thing about ketamine is it does not flip people from a depressed state to a manic state. So there's a low risk in doing that. And so if somebody had really bad depression that's part of a bipolar picture, I would kind of go with um, the standard 6 infusions, like over the course of 2 weeks. I think again, therapy should be integrated into that. And sometimes people will come in to see us and they have an outside therapist that they might work with as well. And so folks like that, we're not always doing the intensive therapy because those symbols will oftentimes last, a day or so until they can get in with their primary therapist.
What are your thoughts about using ketamine to treat MDD? Again, I don't know what that means, with mixed features, which overall seems to have a poorer prognosis. I hope you can understand that.
Yeah, so that's what is my opinion about treating using ketamine to treat somebody with major depressive disorder with mixed features.
Which overall seems to carry a poorer prognosis.
Yeah, and so I don't know if that person, well, what I would say is first, I'd give it a try. I mean, this person probably has tried a lot of other things and with little success. So I would certainly give it a try. If you're referring to, when you say mixed features, if they're talking about psychotic features, because sometimes that is one of the rule out, or it used to be one of the rule outs for ketamine. If somebody has active psychosis, that they're not a great candidate for ketamine treatment, because ketamine treatment can cause somebody to kind of dissociate from reality. That's kind of part of what it does. And I would distinguish between the psychosis associated with something like schizophrenia and the psychosis associated with something like depression or bipolar disorder, or even anxiety for that matter, where the person with that type of psychosis usually has a little bit more ability to reality test than the person who has the chronic schizophrenia. I wouldn't necessarily treat somebody with chronic schizophrenia who's actively psychotic. If somebody had schizophrenia, or I should say schizoaffective disorder, where they had schizophrenia, but they're having depression, I would treat that person as long as they're in a state where they can kind of distinguish reality from a non-reality state. And the same thing would be true in somebody with major depression or bipolar depression who is having some psychosis. I would treat that person because it may be that the depression is fueling the psychotic thought process. And if you treat the depression, you treat the psychosis, as opposed to ruling them out. But I'd be careful. I'd want to be careful.
And by the way, I'd just like to cover my bases here. Another disclaimer: he's giving general thoughts, not one-on-ones.
Not medical advice. ILC is not liable, nor is I guess nor am I for.
No, not at all. And but I love, and in that vein, by sharing the disclaimer too, that he's been Dr. B's been so open and about sharing his thoughts on all of these matters and sharing his experiences. We've been so appreciative of that. Okay, Dr. B, someone says they mentioned the weekly integration groups, like via Zoom, particularly having been helpful support groups. I'm going to say, to process the sessions with ketamine. And I'm just saying a statement from one of this is an anonymous person, but I think they're asking your opinion about group work alongside of ketamine treatment. And
yes, I just saw that person. They seem like a, so yeah, yes, the answer is yes. There are some clinics around the country that do that. And I think I haven't necessarily done that yet because of the logistics. I haven't figured out how to do it with the logistics. However, we're all more comfortable now with Zoom than we used to be. In the clinic that I know that's doing that is doing kind of an online Zoom group, like a processing group. So yeah, I think that person was talking about like kind of it looks like they had some experience with like integrating some psychedelic experiences. And so yeah, I think the more chances you have to integrate a psychedelic experience, the better. And it's an excellent suggestion. It's something that I've thought about for my clinic to kind of integrate, help people with their integration process. I will say the folks, you know, depression unfortunately gets stigmatized, and a lot of people don't necessarily want to talk about their depression with other people that they don't know. The gentleman that seemed to type that question it seemed like he was talking about psychedelic integration and having some experience doing that with that. That's kind of a different dose sometimes than and maybe a different patient population than I'm seeing typically. It's the folks that I'm seeing here are more dealing with a mental health issue that we're trying to treat and less of an exploratory thing. Doesn't mean that, you know, a weekly integration group wouldn't be helpful for them, but I also think a lot of groups like out west, like a lot of the clinics out west are more able to do that because they also have a lot of patients that are kind of coming for more exploratory purposes.
Yep. Well, the last comment was by Penny and just saying thank you. She's in treatment, she said, using it, and has seen very good things, and thanking you for your time and sharing about this particular treatment you found to be very helpful.
Yeah, Penny, and thanks for, I appreciate you saying something. It's always good to learn about other things, and I appreciate kind of you being willing to kind of put your name to something and telling us that. Thank you so much.
Well, we've had about 11 people hanging on to hear the after
I got nothing
session. That's great. But I think we're out of questions, and I know.
Okay, well, thank you all for listening.
One thing you need to do if you're still hanging on is ping NashvilleKetamine.com. Say thanks to Dr. Barton, but also say more. He's been so gracious in offering his time, his experiences, and expertise today. And again, go to integrativelifenetwork.com. That's where we've been doing these type of webinars and questions. And Dr. B, thanks. I hope to meet you very soon when the world kind of opens up. Be able to shake your hand and say thanks.
Yeah, man, my pleasure.
Okay. Well, thanks, Dr. Barton. You have a great day.
You too. Take care.